In this last video, just want to talk about endocrine disorders, just a few endocrine disorders, so that when you see them, you could recognize them. When you hear some of the terms, you have a picture in your mind, okay? So one of the biggies is when someone has a hyperactive thyroid, they have this bulging effect of the eyes. When they have something called Graves' disease, they have this bulging or pushing out of the eyes that are referred to as exophthalmos. That's seen with a hyperactive thyroid or excessive thyroid hormones called Graves' disease. Okay? When we have an excessive amount of growth hormone, we can get something called giantism when it happens in a younger person. When it happens in an older person, we call it acromegalia. That's when the eyebrow becomes real thick, the forehead becomes very like Neanderthalish, the jawline protrudes and becomes very thick. Okay, that's acromegalia. So excess growth hormone during adulthood is acromegalia, but excess growth hormone in adolescence, that's giantism. A goiter is when we have an enlargement of that thyroid gland. That's called a goiter. Cushing's syndrome is when you get like this moon face, a very round face. You get really, really red cheeks. This is from excess cortisol. That's when the glucocorticoid known as cortisol increases, and you start to get that Cushing round face. But you also get in Cushing syndrome, you get this buffalo hump in the back. You get the red cheeks. You get the round moon face. They bruise very easily. There's thin skin. There's high blood pressure. They have this thicker abdominal region, but they get thinner arms and legs. They get the chicken legs, but they get the pendulous, thicker abdomen. You get these stretch marks known as red striations. And those red striations in an individual would look like this. That's called purple striae. This is the moon face. Here is the buffalo hump. And again, you get the thin skin and purple striae there once again. That's called Cushing's syndrome. That's when you get too much glucose, either by endogenous or exogenous cortisol, either too much produced innately or too much delivered to the body externally. And then here's your exophthalmos. You see the eyes, the bulging, the pushing out. You should be able to see the white of the eyes all the way around. Shouldn't be able to see that. That's called exophthalmos. That's from the excessive amount of fat behind the eye pushing the eyeball out. Okay?